Good day everyone! So today I'll show you the donning and removing of personal protective equipment. So let's get started. Here are the following items. You will need a sterile gown. It will help protect your clothing from any type of splashes of body fluids like blood, urine, mucus. Next is a face mask, which you will wear at all times if a patient in droplets. Precaution or you're going to be doing something where there's a risk of you getting spliced and your mucous membrane like your nose or mouth. Next is eyewear. Will protect your eyes from any potential splashes of blood or mucus. Next is caps to prevent or minimizes the risk of hair falling into the sterile area during surgery. Now, let's talk about the sequence of how you would don or put on the PPE. So, the first thing you will do is perform the hand hygiene.
Okay, then we're gonna put on the gown. This particular gown has hooks where you stick your hands. Be sure to use those because that will keep your feeling secure while you're providing patient care. Then be sure we tie all the ties in the back. Next, put the face mask on the bridge of the nose and put the straps around your ears. Pull the bottom of the mask down to cap around your chin. Next is the cap. The hair and ears should be covered to minimize the hair falling during the surgery. Next, you replace the goggles onto your eyes, making sure they fit snugly but not too tight. And finally, don your glove, making sure that you pull the cuff of the glove up over your gown for extra protection.
And this is everything how we look.
Now let me show you the doffing and removing of the PPE. Before removing the PPE, it is very important to know which areas are considered clean versus contaminated. First, remove the gloves. Pinch the cup of the other glove, then you just peel it away and grab the glove's hand, then take the finger underneath the glove. Just peel it off, then discard. Remove the goggles from the strap because remember, it is the clean areas. Next is the cup by allowing it fall forward and then discard. Now we're going to remove the gown. And remember, in the back of the gown and the ties are clean area. So we're going to untie the yellow. Then we're going to slide the arms through the sleeve and pull the gown and roll the gown into the bundle, then discard. Then remove the mask through the strap and then discard. Then wash your hands. A sterile field is a work surface on which sterile equipment and supplies are set up. First, select and place into a clean, flat, dry surface to prepare a sterile field. From a sterile linen wrap package, begin by placing the package on your work surface. Unwrap both layers by first opening the outside cover. Grasp the outer surface of tip of the flap, keeping your arm outstretched and away from the sterile field by allowing it to lie flat on your work surface. And it is ready to serve as sterile field. Remove the cap from the bottle with your dominant hand. Slowly pour amount of solution you need into the container. If the emergency permits, recap the bottle with your hand on the label of the cap bottle. Mark the date and the time the solution was opened along with your initial. This is a needle holder or sometimes it is called needle driver. This instrument should be held by placing your thumb and your finger into the rings on the handle. Your digits should not be inserted beyond the distal interphalangeal joint, which allow you to disengage your finger and thumb easily from the rings. If necessary, the index finger can be placed close to the joint of the needle driver, which will allow better control of the tip. This is a pair of adze and forceps. Note that there is two teeth on the side and one on the other side. These teeth interdigitate when the forceps are closed. The purpose of the teeth is to firmly grasp the skin. With crushing the tissue, forceps are held like a pencil, which allow you precise movement of the tip. Remember that these are tissue forceps and should be rarely used for retrieving needles after difficult throws and boggy tissue.